4 million lives worldwide. I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership in the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on. So could you explain what steps you're going to be taking to ensure vaccine guidance is clear, evidence-based, and trustworthy?
We're going to make it clear, evidence-based, and trustworthy for the first time in history.
If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd.
Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the inventors. As I said, Dr. Malone is one of the inventors of the mRNA
That's fine.
vaccine.
That's not
so he knows a lot more
that
about
statement,
it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? It's not true. It wasn't true when he said it, and it's not true when you said it. Secretary Kennedy, later this month, your new panel will meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine, for measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, you owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator,
the obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
how about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel. So,
well, it's a panel you just put those folks on. Far from what you said, they're people with ideas that are completely outside the mainstream.
You mean out of the pharmaceutical paradigm?
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free to...
I know you said that before. I do too.
To make their own choices.
So will they be just as free after these vaccines?
I assume they will be.